Hi, I'm Cindy. I'm a registered nurse, and I'm here to talk to you today about the clinical significance of CPK, also called creatine phosphokinase. CPK is one of the earliest markers used in the diagnosis of acute coronary syndromes and is directly related to total muscle mass and varies from person to person. It is not a sensitive indicator for myocardial injury and often requires a significant increase in order to provide clinical direction. Intramuscular injections and surgery can cause elevations in CPK. Levels peak at 24 hours and return to baseline in 3 to 4 days. It is no longer used to diagnose myocardial infarction, but is used to calculate the extent of tissue injury following trauma, rhabdomyolysis, or myositis.